Welcome to the Rapid Testing Program at Sunbeam. Here is an overview of what you will learn in this training. First, you will learn what is rapid testing. Next, you will learn where you can get further information on how to self-swab. Then, you will learn how to interpret the test results. Finally, you will learn what safety measures you can use to keep yourself and others safe during rapid testing. What is rapid testing? Rapid testing is a tool to prevent and reduce the spread of COVID-19. Rapid testing at Sunbeam uses a nasal swab to test for COVID-19 using the Abbott Panbio rapid test device. There are many benefits of using a rapid test. For one, the test is quick. The results of the test are ready in just 15 minutes. It is also that it is easy to do because the nasal swab is self-collected. Lastly, the test results are reliable. The Abbott Panbio has 99% specificity in providing accurate test results. Who is the rapid test for? You are eligible to participate in Sunbeam's rapid testing program if you are asymptomatic. If you are experiencing symptoms of COVID-19, or have been exposed to a confirmed case of COVID-19, you should not be rapid tested. Instead, you should be tested at a regional testing center. In addition, the location that you are visiting must not currently be an outbreak. During an outbreak, public health will guide the testing measures that will be required. Finally, you must not have tested positive for COVID-19 in the past. The reason for this is that often, someone who has previously tested positive for COVID-19 will continue to shed the virus long after they are no longer contagious. Now you know who can participate in rapid testing, but how is it done? Let's quickly go over the steps. First, you prepare the testing space. Next, you gather supplies. The next step is preparing the extraction tube. This will need to be filled with a small amount of buffer solution that will come in the rapid testing kit. Finally, you will need to prepare the labels. These will identify the test tube and the test cartridge. Once you have prepared your supplies, you will be ready to swab both nostrils. You insert the swab 2.5 centimeters into each nostril, or until you meet resistance. The Ontario Health video titled Self-Collection for COVID-19 Antigen Rapid Testing demonstrates how to self-swab and provides further details on the process. Please watch this video for further instructions. Let's review how you do a rapid test. After swabbing your nose, put the nasal swab into the extraction tube and swirl for 15 seconds. Next, break the swab at the break point and place the blue tube cap on. By removing the white bottom cap, the tube has now become an eyedropper. Squeeze the tube gently and put 5 drops onto the test cartridge at the circular sample well. The test cartridge should be on a flat surface. Set a timer for 15 minutes. When the timer goes off, interpret the results. A preliminary positive test will show 2 lines. A negative test will show 1 line. Once you have interpreted the results, be sure to document them. Once you have completed the rapid test, you will want to interpret the results. First, you should look at the result window on the test device cartridge. It appears similar to a pregnancy test. If both the control line, marked with a C, and the test line, marked with a T, are both visible, no matter how faint, this indicates a preliminary positive test. If only the control line is visible, this indicates a negative test. If the control line is not visible, then the test is invalid and would need to be repeated with a new nasal swab and a new test device cartridge. What happens if you have a preliminary positive? You will need to go home and self-isolate right away. We call it a preliminary positive because the test result will need to be confirmed by the usual COVID-19 test. To confirm test results, you will need to book a COVID-19 test at a regional testing center within 24 hours. If the result of that test is positive, then public health will direct next steps. If the result of that test is negative, then you can stop self-isolating. In addition, if you work at a Sunbeam location, be sure to notify your supervisor or the on-call supervisor. Public health will be notified of all preliminary positive test results to help direct any other safety measures. Let's talk about how we stay safe when performing a rapid test. The first thing to keep in mind is that all testing materials, once used, are considered biohazardous waste. The following items must be safely discarded in the yellow biohazardous waste container: nasal swab, extractions tube, test device cartridge and gloves. After using these materials, they should be disposed in the yellow biohazardous waste bin. Next, you want to make sure you are wearing the correct personal protective equipment during a rapid test. If you are swabbing yourself, Wear eye protection and gloves. If you are swabbing others, or are present within 2 meters of another person doing a nasal swab, wear full PPE. This includes eye protection, mask, gloves and gown. You have now completed the rapid testing training module. If you have further questions about rapid testing at Sunbeam, please do not hesitate to contact us at 519-893-6200. Thank you for doing your part in keeping yourself and others safe from the spread of COVID-19.